Hi, you guys. Good morning. Welcome to Healthcare for You, another episode. My name is Betsy,
I'm Michelle.
I'm Myra.
and today we're going to be talking about emphysema.
So, what is emphysema?
It's a branch of COPD. A general definition is it is an abnormal permanent enlargement of air spaces distal to the terminal bronchioles, accompanied by destruction of their walls and without obvious fibrosis.
Okay,
Oh.
so am I at risk for this?
Not right now, no. I mean, it's just as common for women and men. It used to be a lot more common for men because it wasn't as okay or popular for women to smoke like 30 years ago. But as popularity with smoking has grown for women in the past 30 years, now it's just as likely for women to be to get emphysema. But you have to be the onset is usually between the ages of 40 to 60, and ethnicity wise, it's most common with Puerto Ricans and with people of Northern European descent. So, genetically though, it's really not a big deal. Genetically, genetics don't have a huge play in it, unless you're born with a deficiency of the alpha 1 antitrypsin.
Okay.
So, but geographically, it is most common in the southeastern part of the U.S. and it's least common in the states of California, Hawaii, and Alaska. So, who wants to move to California?
Okay.
That's interesting. How exactly would that affect the HBU family?
Well, because since HBO, we're a university, and student population is most usually between the ages of 18 and 25, and the CDC actually came out with a study saying that 96% of lifetime smokers usually start between those ages, between the ages of 18 and 26. So it's kind of, and even though we're a non-smoking campus, we have a lot of students that don't actually live on campus, So we need to get the word out there about exactly what emphysema is and why, you don't want to smoke because of the long-term effects it can have on your body. So yeah. Okay, well, I think we're going to take a short little break, and when we come back, Myra will start talking to us more about the disease. Thank you, guys. Oh, hello there. How are you today? I have one question for you. Actually, make that two. First, have you ever experienced any difficulty breathing? Secondly, have you ever felt like your chest was being crushed by a stack of books? If so, I might have the answer for you. Spiriva. It is a once daily inhaled medication that can help improve your lung function for up to 24 hours. It works by allowing airflow in and out of the lungs and helping you to breathe easier. Spiriva is a maintenance dose of tiotropium bromide that is taken daily but does not replace a fast-acting inhaler. That means don't replace your rescue inhaler with this. Instead, it can only help with decreased usage of the rescue inhaler. Side effects may include dizziness and blurry vision. Be sure to take caution when operating or driving heavy machinery. Other side effects can include, but are not limited to, a UTI, which is a urinary tract infection, constipation, or increased heart rate. Before beginning Spiriva, you must discuss with your doctor about the other medications you might be using. Do not take Spiriva if you are allergic or have adverse reactions to medications such as tiotropium, ipratropium, atropine, or any other ingredients that are similar to those medications. When taking Spiriva, if you experience itching, hives, swelling of the tongue, or any difficulty swallowing at all, discontinue immediately and seek medical attention. Ask your doctor if Spiriva is right for you, and maybe we'll just fix that emphysema. Hi, you guys. Welcome back to Healthcare for You.
So now we're going to go ahead and talk more in depth about emphysema and what occurs in the lungs. So here's Myra.
Hello. So if I drew a picture here, not well drawn, but just for a visual. In the normal lungs, you can see that the alveoli are smaller and the bronchioles are actually larger. And here in emphysema happens because of the destruction of elastin. So here you see that the alveoli are going to be more larger, and the bronchioles are actually smaller and they're clogged with mucus.
Wow.
So oxygen will be going in, but being trapped inside here because they have a hard time going out. So because of this, oxygen exchange, gas exchange is going to be affected, and just going to make it harder for them to breathe.
So what would like myself and Michelle and the viewers at home, what would we need to know like about signs and symptoms so that way we can recognize if this is happening to us?
Early signs and symptoms would be like shortness of breath, wheezing, dyspnea, gasping, heaviness in the chest. Late stages would be you could actually see the person have a barrel chest because of all the stretching of the alveoli.
Oh, so like expands the chest.
Expands the chest.
Oh,
because
wow.
they're all expanding.
Okay.
And they just have a harder time breathing. And they also, like in the late stages, do the tripod position where they're leaning forward.
Kind of like this, sort of? Like
yes,
that?
leaning forward like that because it's easier for them to breathe.
So it
that
like
way.
helps you to breathe better? Okay.
Yes. So, and risk factors for emphysema would be smokers, people who smoke, people whose jobs exposes them to chemicals like fumes, dust, vapors,
Any kind of pollutant
things.
that's bad
So
for you?
people who work at nail salons, beauty parlors, they should wear masks.
Oh yeah, because you got
protect
hairspray,
themselves.
you got alcohol things you're using, or okay.
And to diagnose emphysema, they do the spirometry. It measures like the presence of airflow obstruction and determines the severity of the COPD.
Okay.
Complications, there's multiple complications like
Pulmonate, or is that what it is?
Pulmonale?
Yes.
Pulmonate, yeah, that's it.
COPD exacerbation and acute respiratory failure.
Okay.
Complications. And then we already discussed how to prevent it. If you're exposed to fumes or any type of things, wear a mask in your job or something. And if you're smoking, try to smoking cessation and eventually stopping. And treatments for emphysema could be like bronchodilators like Spiriva.
Oh, perfect.
And oxygen therapy. So,
Okay.
All right. Thank you, Maira.
Thank you,
So,
Maira.
now on
I
another
didn't know
note,
that much about emphysema.
yeah, on another note, we will now be talking about financial issues and resources for the patient and the caregivers of emphysema. So, do you guys have any financial problems going on at home?
yeah.
Who doesn't have financial problems going on at home? I mean, I definitely do. I'm working all the time, and you got kids, and you got going to school,
Especially nursing school.
especially nursing school.
There's
Yes.
definitely a lot of financial problems. And so financial problems can occur in a lot of areas in our homes, as we can tell earlier. And having a family member with a chronic illness can definitely add to that as well. So patients that suffer from chronic illness may require access to health care, medications, and possibly better insurance that they can afford. And so a lot of medications for emphysema is very expensive, and the insurance does not always cover it. And so it causes stress in the family to be able to afford, the medications for their loved ones. And over time, it causes chronic stress in the caregivers because they have to provide, and if they can't provide, then they feel like, they're not able to, care for the person with the disease. And so after long periods of stress, the caregiver will develop a compromised immune system because of the prolonged stress hormones in their body. And then not only will that affect care for themselves, but also care for the patient. And so the stress of the caregiver mainly comes from focusing on the needs of the patient and then forgetting their own needs. But there are options. So we're going to talk about options for the viewers and also for ourselves. We have a loved one at home that needs caregiving to allow the caregiver rest, such as respite care, adult care centers, or home health aides. But the other issue with that is money. So of course, money always comes into play, and the family is, if they have money, then they can afford outside care. But if they don't, then they have to obviously figure out a way, like maybe taking care of themselves, or definitely maybe part-time adult care centers, so that way they have some time and rest for themselves. But a good thing is that Medicaid and Medicare both cover the cost for a pulse oximeter. So they could put it on their loved ones, and they could test for the oxygen saturation at home and see how they're breathing. And
Which is really important.
It really is.
That's what you said, right?
Yes.
And so that way, the emphysema can be, monitored well and not have to go out to the hospital or any clinic just to see if they're breathing okay.
Right.
And for long-term care, we have nutritional services, preventing additional lung damage and management, and also preventing acute exacerbations, as well as optimizing lung functions. So what that means is emphysema is a lifelong illness with no cure. So we definitely have to manage that over the period of time that our loved ones are alive. And so it could be some trying times for the patients and the family members. So we have emotional and spiritual options for each of the patients to let them know that, what works for them, what doesn't work for them, and each patient definitely is individualized. So if prayer works for the patient, then prayer is something that they could use for a positive coping strategy. Or if they're not religious, maybe they could do, breathing exercises or just a way to calm down, like meditation, or, sit in a quiet room, have music playing. It just depends on what their emotional or spiritual way. But if the patient develops depression or anxiety, which is part of another complication for COPD, emphysema specifically, is that it puts them at a greater risk for exacerbation.
Oh no.
So that's really bad, because if the patient develops depression or anxiety, then it could cause their emphysema to come back up.
So you really want to monitor their emotional stress that they have.
So we definitely recommend a way for, the patient to channel their emotional troubles. So, if you talk to your patient or loved ones, like, let them know how you're feeling and talk to them
ask
sometimes.
more specific questions.
Yes, ask more specific questions.
How they're feeling, if they blue.
That's really important. And so this way we can prevent unnecessary flare-ups from coming up. And for support group and resources, we have plenty of options. And so some of them we have actually put up the websites for you, and we'll have the links for you. But some of them are American Association for Respiratory Care, Emphysema Foundation, and Family Caregiver Alliance. But for any questions, you may contact Healthcare for You or 1-800-CARE.
So call us.
All right. Bye.
All right, well, that is it for today. Thank you guys again for tuning in, and we will see you next time on Healthcare for You. Thanks, you guys. Bye.
Thank you.